that we have a huge demand. I think it's a pent-up demand because these services were not offered in Sri Lanka before I came here. I mean, they were offered, but not in this way, because I'm a cosmetic surgeon. I treat usually normal people who just wants to look better on the skin, people who want to get better shape, and just get
Talking
younger.
about the history of it, how old is this technology?
Most of the technology I practice is quite new. The cosmetic lasers haven't been around for that long, especially the ones I use today are very advanced, and they have been around only for like 3 or 4 years. And I have been doing lasers for like 15 years.
Wow.
But they change every year. They come up with new technology, new advances. So we can do a lot of things, and people have a lot of options. If they don't want to get old, if they don't want to look, they want to look better, we have a lot of options now.
Wow. Okay.
Shall we speak of some of the available options in Sri Lanka?
Yes, absolutely. Now you have techniques available which are available to anybody in any country today, because I have brought them here.
Right, right, right. Okay.
Now, if you want to get a better shape, for example, now most of the time we go out of shape because we have unnecessary fat collections, usually in the abdomen, maybe underarm, maybe in the back. So when you go out of shape, what can you do? Well, most of the people think probably that we can do exercise and diet and lose it. But when you do that, what happens mostly, you may lose the fat, but you don't get the shape back. You get loose skin, you get wrinkled skin, and in the face, when you lose weight quickly, you will probably look older. But with new techniques, I can remove this fat in a few hours, and you can get the shape back. The most people in Western countries do this.
This is liposuction.
Not to lose weight, get their shape back.
Right.
So this is liposuction, but with new techniques.
Okay.
Those days when you go for a liposuction, come home. Well, you do it under general anesthesia in the first place. So usually there's a certain amount of mortality. Some people die from it. Usually maybe 1 in 5,000 in advanced countries. So with new techniques, nobody dies. You can do a liposuction without fear of death.
Wow.
Because the new techniques do only local anesthesia. That means you avoid going into a coma. When you go to general anesthesia, that's pretty much induced coma.
So basically saying that evolving technology is it's no longer rather life-threatening. If it's not life-threatening, what are the potential side effects or the long-term effects?
Right, absolutely. Potential side effect, you get prettier and younger.
That's not an effect. That's a potential. So there's a potential surprise, a potential gift.
With the new techniques, you can come to my office today, and you can be at work tomorrow with a better shape. You may have a slight amount of pain, maybe a slight amount of swelling for a couple of weeks, but usually which can be handled with a couple of tablets of Panadol. Nothing more than that.
Right. Well, you speak about how you can get prettier, but obviously liposuction is one of the biggest cases that the highest number of cases that you always handle. But what are the other kind of demands that you get from patients in Sri Lanka mostly?
Now, with new techniques, not only we remove fat, but we use fat to rejuvenate a person's body.
Wow, okay.
So this is one of the latest techniques, because before this, when people got older, what they did was they would cut their skin, pull and stitch. But you don't really get your younger face, you get an alien face. Now, with the fat grafting, we can remove that fat, and on the same day, we can inject it into your face, into the areas where you get old. Now, we know people get old because they lose the volume of the body, I mean, and the face especially. Not because your skin is just getting lax. So if you feel that volume, you exactly get the same face you had maybe 10, 15 years ago.
Wow.
But if you want to be prettier, you can actually be prettier than before as well, because you can augment necessary areas like lips, for example. You can get high cheekbones. You can enhance your chin. So whatever you want, if my patient says, I want this, usually I can match their needs to, exactly.
Wow, the Staying Forever song is not a dream anymore. But anyways, we have a caller on the line. Hello, good morning.
Hello.
Hello.
Good morning. Hello.
Hello, good morning.
I'm speaking Sajid from Ambar.
Satish from Amparo, is it?
Yeah,
hello.
Right.
Could you have him on the studio? Could we have him to speak on the studio? Hello.
I can hear, sir.
Yes, speak a little louder, please.
No. Hello.
Hello.
Okay.
I think we lost him. Sorry for interrupting you, Mr. Gamage. But you were talking about how, you don't have to, even though you grow old, you can look prettier. I don't mean to offend you by any way, but how is this ethically right?
How is this ethically right? Now, today's world, most people don't retire when they're 55. I mean, you realize with, economic depressions and all that, most people have to work until they're old. Now when a person gets old, usually what happens is not that they lose their energy, they're not unhappy or anything, but their faces look sadness, their faces show tiredness, which they don't really have, and most people don't want to show that. So ethically, it becomes an issue only if what we are doing causes any kind of problems later on, such as risk of dying or risk of cancer. With these techniques, absolutely there's no such risk. And so it's safe. Once it's safe, you know, most of the ethical issues go away.
Fair enough.
Now, if you're going to do a surgery and there's a risk of dying, you don't want to look better if you have a risk of dying.
Fair enough.
But now you can do it without that fear. So the other thing is most people in the Western world, of course I came from the cosmetic capital of the world, Los Angeles. Everybody does these things. So usually it's the society does not have any stigma.
Right.
I mean, they talk of it as if you're going for a haircut.
Fair enough.
Over here in Sri Lanka, our culture is
It's a
different.
big deal.
And most of the people who come to me don't tell even their husbands or don't tell their family because that stigma is there in Sri Lanka.
Right, right.
But I believe as the country advances and our economy improves, those things will probably change.
And don't you feel that you might be, I mean, with this we are going against the form of what actually what nature does, the form that nature takes with you know?
Yes, I mean, if you want to live with the nature, you should go to the jungle and live in the jungle.
Fair
and you should die when you're 40 years old.
Fair enough.
We live today, we live to be old because we have all these advances of the science.
Fair enough.
Not only the science, the economy, right? But if you want to live in today's society, we want to protect ourselves from the nature. To tell you the truth, the nature is what makes us old. For example, what makes you old? What makes you old is the sun. If you go in the sun, wait in the sun, thinking the nature is good, you're going to die early and you're going to get cancers and wrinkles and ugly and probably dark as well. But if you protect yourself from the nature's extremes, especially extremes of cold, extremes of heat, you're going to have a long life. So similarly, you know, we want to use what we have. Now in this case, I'm making people look younger by using their own fat.
Fair enough.
So the nature has designed us to get old and die after you're 35. In the case of a woman, you know, after that, they don't have a purpose.